From New York to our TV and radio audiences worldwide, and welcome to Balance of Power, where the world of politics meets the world of business. I'm David Weston. I want to start today with a quick check on the markets, and for that we go to Taylor Riggs. So it looks pretty good for equities at the moment, Taylor.
Yeah, David, very interesting that we came in overnight and futures were negative. We seem to have turned that around. So far, S&P 500 up about 2% or so. Crude, though, still heading a little bit lower. This is as there's still a lot of concerns, not only on the supply side, but the demand side as well. Briefly last night, dipping to a 19 handle on crude, so trying to recover just a little bit and hang on there to a 20.30 here on crude. Bloomberg dollar index still firmer. We had 4 days of weakening on the Bloomberg dollar index last week as we'd seen some of the funding pressures relieved, but the safe haven again turns around and further strengthens today. What that means, though, is the VIX still continues to head lower. David, a 59 handle on the VIX is something that certainly feels a little bit less panicky than an 80 or so that we've had in the last few weeks, though this is still pretty elevated, I would say, at a VIX at 60. I do want to quickly just talk about some of the individual stocks that were moving. As you can see, it is interesting. You have a lot of these stocks rising and falling despite some of the overall gains that we're seeing within the S&P 500. Carnival Cruise, of course, as we know, you've seen a lot of some of these cruise lines extend the ban on the travel limits that we've seen as the president overnight now saying that we're sort of extending this lockdown period, if you will, through April 30th. Boeing as well getting another hit after posting, 80% gains or so last week. Boeing is now saying, Barclays is saying that Boeing could and Airbus combined could see production cuts of 30 to 40%. So you're really seeing Boeing getting hit. Disney, though, one of the strong performers, at least today. Goldman is saying that Disney and Marriott are some of the few coronavirus picks that despite the shutdown, some of these stocks really should recover. So interesting to see Goldman coming out and saying that, you know what, Disney may be hanging in there after all, David.
Okay, thank you so much to Taylor Riggs. Various medical and health insurance companies across the country are doing what they can to help in this coronavirus. And the latest is Cigna, and it's gotten specific approval from the President of the United States, who really complimented them on what they've done. In part, what they've done is eliminate copay for the treatment of coronavirus, but they've done much more in addition. And here to explain to us is David Cordani. He is the President and CEO of Cigna. So, David, thank you so much for taking time with us. Explain to us your most recent announcement.
David, good to be with you today. So we took a step forward after clearing the way for individuals to cover their testing, clearing the way relative to telemedicine and 90-day pharmaceutical supplies. We took a step forward today and announced that we are stepping in on behalf of our customers to take care of their financial out-of-pocket costs as relates to COVID-19 treatment, whether that's a copay, co-insurance, or otherwise. We felt as though, given this unique time we find ourselves in the United States, that step was warranted to provide the peace of mind to the individuals we serve. So it's a meaningful step forward. There's 2 additional items we announced as well. We're transferring or redeploying several hundred of our nurses and doctors to go support telemedicine infrastructure with some of our partners as more individuals look to telemedicine to fulfill their needs. So we're expanding access from that standpoint. And then lastly, David, we're standing up with a partner of ours, an artificial intelligence partner of ours, an online free capability to go in and risk check your COVID-19 or health symptoms to help you determine whether or not you may be confronting the disease or not, and try to help to provide information to individuals before they may need to go pursue testing or otherwise. So some really important announcements, all putting our customers or patients front and center in the decision-making.
So, Dave, give us some sense, if you can, of the possible range of the copay part, the first part that you mentioned there. We hope that not many, a high percentage of your people actually get it, but potentially how many people could that affect?
We don't have an estimate in terms of individuals. Obviously, the rate and pace of that is going to be highly dictated over the course of the next month or so as it relates to the effectiveness of the U.S.'s policy around social distancing and the like from that standpoint. But we were clear this covers our commercial risk population, our commercial exchange population, our Medicare Advantage population, our Medicaid population, and then also our global clients for those individuals who are consuming care in the United States. And then lastly, for our corporate ASO clients, we're working with those clients to advise them on positioning they should take as we serve them on their behalf. So we do not have a patient estimate at this point in time.
David, you mentioned telemedicine, which is something that we're talking about a lot these days, both because hospitals are way overcrowded, but also there's some risk in just going to your doctor, given the need for social distancing. What are you seeing in terms of increases in telemedicine that warranted you sending these physicians, these clinicians, out to help?
Sure, David. So even before COVID-19, we as a company were stepping forward saying we wanted to expand what we call the front end of care. And bring more care and more services to individuals. So in three different ways. One is telemedicine, both medical as well as behavioral health services. Second is to attempt to re-envision what could take place in the home in terms of expanding what could take place in the home. And then third is working with our physician partners to expand the services that could take place in a less invasive setting, more specifically in a physician's office as opposed to an outpatient facility or the like. So point is, we've been ramping toward an expansion of virtual care and in-home care in advance of COVID-19. Now, to your core of your question, individuals are more open to experiencing care virtually today than ever before because of COVID-19. And we're seeing the volumes ramp in quantums, multiples of what they were ramping at in advance for both medical health as well as behavioral health. And that's what led us to redeploy resources that we have, nurses and doctors, to partners like MD Live and others to expand that reach. And we think this will be a societal change that probably will continue to go forward long after COVID-19 because it's a convenient, safe, effective, evidence-based way to consume many aspects of care.
David, we're all focused, of course, on COVID-19 and the disease that is spreading across the country. But I know, because you and I have talked about it before, you're also concerned about what you call whole person health. Right now, there's a lot of strain being put on that because we all are in remote locations with our families or even alone. How are you addressing that issue?
Yeah, so David, I appreciate the whole person health. That is our orientation around trying to connect the mental health and physical health aspects. And just as a backdrop for your audience, we know today in the United States, as an example, if an individual has a chronic disease, of which about half of Americans confront at least one chronic disease, you're 7 times more likely to have clinical depression than if you don't have a chronic disease. But if that clinical depression goes untreated, you're more likely to have follow-on onset of additional medical or behavioral conditions from that standpoint. So we bring the behavioral health resources into our chronic or case management system from that standpoint. In the current environment, it's going to get strained even further because there's separation that is taking place, to your point, and we know that separation increases loneliness, and loneliness increases mental health challenges. So we're expanding and trying to press ourselves relative to, as we talked about, telemedicine for behavioral health, but also inbound interactions to our customers or patients from our nurses, from our behavioral health professionals, from our health coaches, to try to elevate and broaden the levels of engagement, especially during this unique time. So I think it presses the importance of engagement up even further, and it presses the importance of whole person health even further, and we need to be creative in terms of how we step up to it in this interim period of time.
David, Cigna is an integral part of the overall healthcare system in this country. Give us some sense of just how much stress and strain is being put on that system. Is it up to the task? What does it need?
Well, the U.S. healthcare system's quite sophisticated and multidimensional. And as an American, I feel fortunate to have access to that for myself and my family. No doubt it's under strain because it's imbalanced at this point in time. So when you take dimensions of the sophisticated surgical interventions we have around musculoskeletal or otherwise, many of those services are being deferred at this point in time because of the importance of the acute inpatient services. A concrete example, we and others in our industry step forward in consultation with hospitals to try to change and accelerate protocols to help to get individuals who are non-COVID-19 patients who could be transferred out of hospitals into long-term care centers, skilled nursing facilities, or even coordinated services at home. That takes some pressure off of the delivery system, the acute delivery system, and creates more capacity for the needs of COVID-19 patients. Lastly, as we're seeing there's an imbalance taking place, not just in terms of the acute healthcare system, but also around the country. So as the waves move through the country, we have the opportunity for learning to take place as best practices are happening from some of the initial hotspots like the Pacific Northwest or now greater New York, for other locales to learn in advance and be more prepared from that standpoint. So quite sophisticated. People are pulling together in cross-industry ways I've not seen before in my career, but it is under strain, and we need to be supportive of our healthcare professionals accordingly.
Finally, David, how is Cigna itself holding up? You have a lot of employees whose work is really critical, incredibly critical right now. How do you protect them at the same time that we have them deliver the services that we really need?
So I appreciate the question. We have over 70,000 colleagues around the world, and we dealt early on with the COVID-19 challenges in Greater China and then South Korea and matching around the world. What we've done is, first and foremost, work where at all possible to help our colleagues have the proper capabilities to work from home to be safe. Secondly, for our colleagues who need to be physically present in an office or delivery infrastructure, be it tied to care delivery, care coordination, pharmacy servicing, et cetera, key technology resources, we've sought to make sure we have the right social distancing and infrastructure around them. We've increased payroll for those individuals who actually have to be on site. So we've increased what we're paying. We've added another 10 days of what we call emergency PTO, or paid time off, for individuals who may need additional time off during this unique time frame to care for parents, to care for children, just to manage the household or otherwise from that standpoint. And we're pressing ourselves to make sure we have broad connectivity in our organization and communicating on a regular basis. So I'm really proud of the way our team is holding up, putting our patients and customers front and center, but we're also trying to make sure we're being mindful of the strain that our colleagues are under right now, and so far, so good from that standpoint.
Okay, David, thank you so very much for spending time with us today. That's David Cordani. He is the president and CEO of Cigna. And now it's time for Bloomberg First Word News, and for that, we go to Mark Crumpton.
David, thank you. European officials are warning against loosening lockdowns. That's after the coronavirus outbreak claimed more than 3,000 lives in Spain and Italy over the weekend. The total death toll for the two countries is now over 17,000. The pace of fatalities and infections is showing signs of leveling off. We just learned that Italy has reported the lowest number of cases in nearly 2 weeks, but officials are warning against complacency. President Trump says that he plans to call Russian President Vladimir Putin to discuss that country's oil price war with Saudi Arabia and the global response to the coronavirus pandemic. Mr. Trump says he doesn't want to see the energy sector, quote, wiped out over low oil prices brought on by the conflict feud. Oil recovered slightly after tumbling to $19.92, a 17-year low. Hungary's parliament has handed Prime Minister Viktor Orban the right to rule by decree indefinitely, effectively putting the European Union democracy under his sole command. Hungary's ruling party overrode objections from the opposition in a vote today, handing Orban the right to bypass the assembly on any law. The justice minister dismissed criticism, saying measures will be taken that will be proportionate to fighting the coronavirus. In Israel, Prime Minister Benjamin Netanyahu will go into quarantine. His office says he came into contact with an aide who tested positive for the virus. Netanyahu and his staff will stay in isolation while they await the results of their tests. Global news 24 hours a day, on air and on Quick Take by Bloomberg, powered by more than 2,700 journalists and analysts in over 120 countries. I'm Mark Crumpton. This is Bloomberg.
Thanks so much, Mark. Coming up here, we're going to be joined by David McIntosh at the Club for Growth, what he likes about that $2 trillion package and what he would have done differently. That's coming up next on Balance of Power on Bloomberg Television and on radio. This is Bloomberg Balance of Power on Bloomberg Television and Radio. I'm David Weston. Most people, particularly the markets, really like that $2 trillion stimulus package or spending package that we got last week. But some people ask some questions about it, including David McIntosh. He is president, of course, of the Club for Growth, and he joins us now. So, David, give us a sense. First of all, thank you for joining us. Secondly, give us a sense. What do you like about it? What don't you like about it?
Thank you, David, and appreciate the opportunity to talk with you. I hope everybody's well there. I'm worried about the overall deficit that it's creating. The $2 trillion figure, when you put on top of the $2 trillion that they spent earlier in the year, that's $4 trillion plus whatever the Federal Reserve is doing. But we recognize there's a crisis, and the economy is being shut down by the different government actions, so something needs to be done. Within that, what we like is that much of the program is set up as a loan program so that some of that can be repaid to the federal government. We think that's a smart way to do it. We also are basically, I view it as a lost opportunity. The cash payments don't stimulate economic growth. They're just a transfer payment. So we would have suggested switching that into monies that would have directly gone to businesses to create and keep jobs so that people could stay employed. And then our big mantra is, first of all, do no harm. And in the previous bill, I think the House and Senate and Mnuchin negotiated this mandatory paid leave provision. And small businesses, that creates a huge cash flow problem, even if the government says they'll pay them back and make them whole someday. And so I suspect that's one of the reasons we saw an even higher spike in unemployment as small businesses looked at that coming down the pike. They're already losing revenue dramatically and thinking, I don't have cash to make payments to employees. I'll have to let them go and let them qualify for unemployment insurance.
So that may have put some burden on small business. There was also a fair amount of provision in there for helping small business, which is so much the engine that drives the U.S. economy, and particularly employment, as you suggest. Are we doing enough for small business?
I think a lot of the loan programs are very good. I think giving them as much flexibility on and bridge loans, essentially, so they can get through the cash crunch is going to be important. But honestly, the most important thing for small business will be, when it is safe, reopen the economy, because that's how they can survive and do well. And I know the president now has extended to the end of April the date when the things were going to need to be shut down. And we've got to talk to the scientists and the doctors to understand the medical needs. But on the top of everybody's list has got to be, okay, but as soon as it's safe to open up, maybe just parts of it. Maybe young people can go back to work because they're less likely to be affected by this. Or we'll have to figure out ways to reopen the economy as soon as it makes sense.
What do you make of that? Because it's becoming really a sort of an ethical debate across the country about whether we should take some risks, knowing that some people might lose their lives to get the economy going. And some people, like Lloyd Blankfein, for example, for Goldman Sachs, says if you crash the economy, you're going to lose lives because of that.
He's absolutely right. There's studies after study that show unemployment actually increases the death rate for people who are on unemployment or not occupied. And so there's a balance of risk. I think it's important for the health care system and the president to put things into context of, I saw today an estimate, maybe 200,000 deaths. There are over 2 million deaths a year in the United States, but that's a big number. And one of the things I think everybody's buying into and makes sense is flatten that curve of exposure so that more of those people could be treated and lives saved that way, and the healthcare system isn't overwhelmed with the big spike. I mean, basically, epidemiologists tell us when you have a new bug like this that is potentially deadly, it's going to spread quickly, and it'll be an epidemic, and then the society adjusts to it. Our natural immunities kick in. We have people that are not vulnerable to it, but we've got to get our society through that spike and then reopen the economy to keep people going after that.
And finally, David, what about the grants to the large corporations? You talked about small business. I know the Democrats put some restrictions on that, some oversight. Did you approve of that?
I think the most important thing is to keep things very flexible and to not have the government start picking winners and losers on those larger corporations. As much as possible, do it as a bridge loan and then let it get back into the marketplace. And stock values will start to go back up, as the president said. Some will take longer, right? It'll take a while for the cruise industry to recover because people will be less likely to take cruises for a while until their comfort level goes back up. The government shouldn't prop up every business and every industry, but I think we should provide that liquidity in the short term to help in that way. One of the things we should avoid are mandates. I talked with you earlier about the Defense Production Act. That's a way of ensuring that it actually is harder for business to respond to the crisis because they have to sit around and wait for orders from Washington exactly when they make things, how much, and where.
Yeah, that's fascinating. David, thank you so very much. This is David McIntosh. He's the president of the Club for Growth. Coming up later in the program, we're going to talk with Senator Ted Cruz of Texas about exactly what needs to be done for the states and their budgets. That's coming up on Balance of Power on Bloomberg Television and on radio. Time now for Stock of the Hour, and for that we turn to Kaylee Lines. Kaylee?
David, I'm looking at American and United Airlines. They're down about 11 and 6% respectively today. An analyst over at Bernstein, David Vernon, said they have less than 2 months before they run out of cash given their current liquidity levels. For American, for example, it had less than $250 million in cash at year end. Now, Vernon isn't saying they're going to go bankrupt in 2 months. He notes that they do still have other assets. And then, of course, you do have stimulus aid coming from that package that President Trump just signed on Friday, $61 billion for airlines. If American got $12 billion of that, for example, he says their cash could last for closer to a year. But stimulus aside, it's not really aiding sentiment when it comes to the airlines. The S&P Composite Airline Index is down about 35% this month, on pace for its worst month on record. And that's because even if the government gives them aid to weather this storm for longer, there's no telling how long this storm is going to last. And that demand for air travel has just absolutely collapsed as the coronavirus continues to spread, David.
Okay, thanks so much to Kaylee Lines. Coming up here, we're going to talk with Alex Gorski of Johnson & Johnson about that candidate they've identified for a possible coronavirus vaccine. This is Balance of Power on Bloomberg Television and on radio. This is Balance of Power on Bloomberg Television and radio. We want to go now for First Word News to Mark Crumpton.
David, Italy reported the lowest number of new coronavirus cases in almost 2 weeks as the epicenter of Europe's contagion enters its 4th week of lockdown. New infections in the past 24 hours totaled 4,050 compared with 5,217 the previous day. It's the smallest increase since March 17th. However, fatalities from the disease rose by more than 800 on Monday, compared with 756 a day earlier. Italy now has more than 100,000 cases of coronavirus. Spain is reporting more than 800 new virus deaths today. That's down slightly from the previous day, but total fatalities in Spain are now well over 7,000. As Spain battles Europe's worst outbreak after Italy, the country is tightening restrictions on the public. Those who work in non-essential services are being told to stay home during the Easter period. And over the weekend in Spain, the number of patients who needed intensive care surpassed the number of available hospital beds. South Korea is giving gift certificates and electronic coupons to all but its wealthiest citizens. The move is to help deal with fallout from the coronavirus pandemic. Most of the payouts will be about $800. South Korea says the measure will cost more than $17 billion. Officials ruled out giving cash to ensure an increase in consumer spending. A new start date has been chosen for the Tokyo Olympics. Japanese broadcaster TBS is reporting the Games will kick off on July 23, 2021. The Olympic Games had been set to take place in Tokyo this summer, but were postponed because of the coronavirus pandemic. Japan has spent more than $26 billion to get Tokyo ready for the Games. That's according to some estimates. Global news 24 hours a day, on air and on Quick Take by Bloomberg, powered by more than 2,700 journalists and analysts in over 120 countries. I'm Mark Crumpton. This is Bloomberg. David?
Thanks so much, Mark. Johnson & Johnson made news today when it said that it identified, working with HHS, a possible candidate for a coronavirus vaccine. It'll go into testing in September, and in success, if it succeeds, we could have something as early as the second quarter of next year. Earlier today, I got to talk with the chairman and CEO of Johnson & Johnson, Alex Gorsky.
We're very hopeful as we look at our early data that in these cases tends to be, quite correlated with what we would expect to see as we take this into human testing in September of this year. But we also know we need to complete those other trials, and we'll be doing that. At the same time, we're going to be ramping up our production, and we'll have global production. We expect to have that both in Europe as well as the United States. And we expect to be in a position by the first quarter to have a much better perspective on the vaccine itself, on the kind of quantities that we would have available. Our goal is to have hundreds of millions available by that time. And then obviously to work with regulators and other people around the world, depending on where the coronavirus is at that time, to try to make this accessible on an emergency basis.
Alex, give us a sense of what that testing process is. Is it the normal testing process you'd have for another vaccine, or given the urgency and the size of this problem, are there certain things that can be done to expedite that?
Well, David, look, my sense is that regulators, both in Europe and the United States, let alone around the world, other healthcare authorities and the government are doing everything they can to expedite this. At the same time, we have to balance that to make sure that we gather the efficacy, the safety data that's so important before, of course, we would be using this on a large scale. Now, in this particular case, we're working with a platform. So think of it as a vaccine, part of a vaccine, where we've got significant experience in areas like SARS, things like Ebola, things like HIV. And so we are confident in the safety data that we've seen thus far. And it's already, the vector's been used in elderly, it's been used in younger children. So that gives us confidence from a safety perspective. The early testing that we've done so far, that includes a range of animal as well as in vivo testing, also indicates that we should have an active vaccine as well. But of course, we need to complete the trials that we'll be doing in humans in the fourth quarter, before we develop the final data set, that would help us make that decision at the appropriate moment.
So to push ahead and push perhaps farther than we should, if you were successful, in the fourth quarter, when would we have a vaccine available to people?
So, David, look, what we would intend to do, again, work closely with regulators so that by late December or early January, we would expect to have some type of interim analysis in our first in human trials. And then at that point, we would have to take a look at that data set in its totality. I think clearly we would be also looking at how is the virus proceeding and what kind of state is it in around the world, and then make a decision. So I think at some point in the second quarter, we could be in a position, again, on an emergency basis, depending on where the pandemic is going, where there could be some access to this, and then we would expect that to ramp up significantly over the rest of the year.
Give us a sense, because I know you're committing a lot of funds to production, not just the development of vaccine, but in success to be able to produce a lot of it. How big could you get? How soon, if in fact it does work?
Well, you're right, David. To have a vaccine to really work effectively, it takes two components at least. I mean, first of all, it's demonstrating efficacy and safety of your vaccine. And that's what we're working very hard on, literally as we speak. But also, as I said, some of our trials will start in September in human. We'll have some additional data by December. But you also need to produce them in sufficient volumes and quantity so that you can actually make a difference in the broader population. And we're very fortunate in that we have a very unique production capability where it gives us the ability in relatively small containers to make very large volumes in the hundreds of millions of doses of this vaccine. Now, again, let me be clear. We still have more work to do to determine the exact yield of these particular technologies and to compare that versus the safety and efficacy data. But based upon the original work that we've done, again, we feel quite confident that we can be in the range of hundreds of millions of vaccines as we would move into the early part of 2001 with a goal to have 1 billion in place by the end of the year.
And you want just the Dow thing, right? Okay. Of course, Alex Gorski, he is the chairman and CEO of Johnson & Johnson. Coming up later today, I'm going to talk with the CEO of Dow. He's Jim Fitterling. They're making a big announcement about really ramping up production of hand sanitizer. This is Balance of Power on Bloomberg Television and Radio. This is Balance of Power on Bloomberg Television and on radio. I'm David Weston. We want to talk about oil now because it really hit some extraordinarily low numbers, particularly with WTI at one point going below $20 a barrel. At the same time, President Trump says he wants to call Vladimir Putin over in Russia to see if he can adjust those prices somewhat. We will now turn to Bloomberg's Pratish Narayanan for a report on exactly what's going on with oil. Pratish, thanks for joining us. Give us your sense.
Yeah, it's essentially what we're facing is a pretty unprecedented situation where we have a glut of supply, and that's what caused most of the previous oil crashes that we've seen recently. But what's unique about the current situation is that demand is also crashing because of the coronavirus crisis. So as economic activity goes down, as people stay at home, fuel use is coming down. So people, just don't need as much oil. But at the same time, the likes of Saudi Arabia, Russia mainly, they are pumping more and more into the market because they want to kind of sell as many barrels as possible and keep their market share. So that's the situation we're seeing. That's why you're seeing oil basically get beaten down, below $20 a barrel today.
So, Pratish, give us a sense of what really would be in it for Vladimir Putin to accommodate President Trump. And we have all those sanctions on Russia, particularly going after that Nord Stream pipeline up through the North Sea. What could President Trump, or might he have to give Vladimir Putin to really get him to bring the price of oil up?
Essentially, there has been speculation in the market that Putin went ahead and started this price war with Saudi Arabia more to hurt the U.S. and by extension the shale industry in the U.S. rather than going and having a fight with Saudi Arabia. Now, obviously the U.S. has placed sanctions on various Russian entities, including their oil companies. So that might be a concession that Putin is probably seeking. We don't know. We don't know the exact nature of the talks at this point, but that is presumably what he's seeking. But also, Trump is limited in his response because if he is to ease sanctions on Russia, he will need the backing of Congress, and that's probably not likely in this current situation.
How much damage is being done to the shale producers right now? We see energy company after energy company cutting back on capital investment. How much are they really taking out that can't really go back very easily?
For the likes of Saudi Arabia, the cost of production is very low. Essentially, they can produce a barrel of oil at essentially $3. But that's not the same case with shale. It requires anywhere from $25 to $30 a barrel for it to be commercially viable. And now with prices consistently kind of going down below that $25 a barrel level, many of these companies are essentially facing, having to produce at a loss. And that's obviously not sustainable. Many of their credit lines are already stretched. They're not kind of able to go to equity markets. They're not able to go to debt markets. So you could see a lot of essentially crashes and bankruptcies going forward.
So, Pratish, we hear about the cost of extraction, but there's also something I've heard called the fiscal break-even point, which is, I'm told, higher for Saudi Arabia than for Russia. How much pressure does Vladimir Putin have on him with respect to his own budget back home?
Russia, to its credit, over the past few years, they've worked to kind of reduce their reliance on oil revenue, especially after the 2014-2015 oil crash when they were really hit. They made some changes where they wouldn't actually be so dependent, and that's probably given him a bit more confidence to go after Saudi Arabia and also the U.S. in this particular price war. So they have made those changes.
And Pratish, final question. We have both Saudi Arabia and Russia basically opening the spigot, really ramping up production as part of this price war. Can they afford to do that forever? Where are they going to store all this oil?
Yes, and that is one of the main concerns right now, because world over, a lot of this oil is coming out in the market. People, refineries are shutting down. They're not producing as much fuel. So where is all this going to go, and be stored? One option is obviously ships, but that costs as well. There are on-land storage facilities, but increasingly we are facing the risk where they will essentially top off. And there is even the possibility that some physical oil prices could go negative, which would effectively mean producers will have to pay buyers to take it out of their hands.
So finally, Pratish, we talk a lot about the equity markets these days and trying to find a bottom, for example, with the S&P. Can you see anything like a bottom for oil at this point, or is it just going down?
At the moment, as incredible as it might seem, there doesn't seem to be a bottom. We've seen in the physical market of actual barrels, prices actually going down to negative. 1 or 2 grades in the U.S. have. So, at the moment, there doesn't seem to be a bottom, and prices are just relentlessly falling.
Okay, Pratish, thank you so very much. That's Bloomberg's own Pratish Narayanan reporting on oil. Coming up next here, we're going to talk with Senator Ted Cruz of the state of Texas about that stimulus, that spending package we saw, and what is being done for the states and those governments that are losing money hand over fist. That's coming up next on Balance of Power on Bloomberg Television and on radio. This is Balance of Power on Bloomberg Television and on radio. I'm David Weston. Well, Congress had quite a busy week last week, but before they got out of town, they passed a $2.2 trillion spending package to try to help the U.S. economy through this crisis right now. We have on the phone with us now one of those involved in this. He is Senator Ted Cruz, Republican of Texas, and we welcome you, Senator. Thank you for being here. First of all, give us a sense. Do you think you've done enough for now, or is there more to come?
Well, David, it's good to be with you. Thank you for having me. And I think what we've done now is emergency relief for now. What the ultimate question is when we are able to get under control and defeat this global pandemic. That's what's driving all of the rest of this. We have 2 crises that are playing out simultaneously. We have a public health crisis with a growing pandemic, and we have to get that under control. We've got, secondly, an economic crisis that is the direct results of the aggressive steps we're taking to contain the global pandemic. And the legislation that Congress passed last week was emergency relief legislation designed to provide real relief to the millions of people across this country right now who are hurting, who've lost their jobs, to the small businesses that are in crisis. And if the crisis continues for substantially longer, I have no doubt that Congress will have to act yet again.
There are so many people and so many businesses that are hurting because we've, on purpose, for good and sufficient reason, really almost stopped the economy throughout a lot of the United States. We also are hearing about the states, the individual states, who are getting crushed both with dramatically increased costs in fighting this coronavirus, but also dramatically reduced revenues because of taxes. Is there enough in this bill to take care of the states?
Well, there's very substantial amounts in this bill for the states. In the bill of the $2 trillion, $150 billion of that goes directly to the states, and it goes to the cities as well. And so it's the states and municipalities are getting $150 billion for their coronavirus efforts, for what they're having to expend additionally combating the coronavirus. In addition to that, there's $100 billion that goes directly to hospitals and other medical facilities. So that's $250 billion right on the front end. But there's also a great bit of immediate relief for individuals and for small businesses. If you look at individuals, every American who earns $100,000 or less is going to get a check, and is going to get a check. If you earn $75,000 or less, the check will be $1,200 per adult. That means if you're a couple, you're going to get $2,400 if the two of you make $150,000 or less, and $500 for each child. That means a couple with 3 kids will get a check for $3,900. That's real money, and that's designed to provide relief for families that right now may be laid off, may not be sure where the rent is coming from next week, and that's designed to help them through this economic devastation we're seeing as a result of the health crisis.
Senator Cruz, how confident are you that we can get the money to the individuals and the companies, particularly small businesses, fast enough? Because part of the problem, we saw the jobless claims just shoot up last week, and part of it's because you have small businesses such as restaurants, for example, who just have to lay people off right away. Can we get money to them fast enough so that people won't be losing their jobs?
Well, I certainly hope so, and let's take it in 2 tranches. Number one, the individual relief. That's going out through the IRS. And Treasury has projected that they expect that to take 2 to 3 weeks. If you are a taxpayer who direct deposits your taxes, in other words, if they have your bank account number and you usually get a refund direct deposited into your bank account, Treasury believes they'll do it faster in that circumstances. The general counsel of the IRS told me he thought those could get out as early as April 8th. It just depends upon how quickly they can execute. On the other hand, if you need to receive a check, printing the checks, mailing the checks through snail mail, that will take longer, but it's still, Treasury is intending to get it out in the next 2 to 3 weeks, and what Congress specified is to get the checks out there as soon as humanly possible. On the small business side, there is direct and immediate relief, and this may be the most important part of the legislation we passed. It is $377 billion in emergency loans to small businesses. Now, a small business is defined as a business with 500 or fewer employees. And if you're right now, if you're listening or watching this today, and you're a small business owner, you can go and get an emergency loan. Maybe you've laid off a substantial number of your employees. You can go, the loans are administered through the Small Business Administration, but it's implemented directly through the banks and the local community banks. So small business owners can go to the banker you normally deal with for business banking needs. And if they're a small business accredited lender, they can administer the loan. The loan can be up to $10 million, so it's designed to be for businesses like restaurants, like bars, like hardware stores, like nail salons, all of these restaurants that, as you noted, have been laying people off in massive numbers. And you can get a loan quickly that is guaranteed. And here's the part that is unusual. If you use that loan to pay salary, to pay mortgage or rent on your business, or to pay utilities, that loan will be forgiven. In other words, it becomes a grant. And so the intention of this is for small businesses to keep their employees on the payroll so that the employees keep getting a paycheck, and so that the restaurant, so that the bar, so that the gym, so that the movie theater doesn't have to shutter their business and be driven into bankruptcy. This is designed to really be a bridge loan to get through the crisis, but the amount that goes to salary and mortgage and rents is forgiven and is a grant to keep those small businesses afloat and prepared to thrive again once we combat and defeat this pandemic.
Senator, finally and quickly, we're all experiencing social distancing. When will we see Congress convene again?
That is unclear. Right now, we are scheduled to return on April 21st. So the plan is to give it some time, give it 3 full weeks, and then come back then. But depending on the state of the health crisis, if it is still a serious public health threat, it would not surprise me to see that date pushed back. You know, if you look at the U.S. Senate, you've got 100 people, quite a few of whom are in their 70s or in their 80s, are potentially in a vulnerable population. And so we met in person the last 2 weeks and passed this legislation, but I think there's some understanding that all of us, I'm at my home, I'm working from home, most of us have gone home to the States, and I'm on the phone with Texans all across the state and the phone across the country working from home right now.
Senator, thank you so much, and we wish that health and safety for both you and your family. Thank you very much. That's Ted Cruz, Senator from the state of Texas. Coming up in the second hour of Balance of Power on radio, we're going to go more deeply into the question about whether we have enough aid coming to the states given all of their pressures. That is Balance of Power on Bloomberg Television and on radio.